I'm going to do a nice little warm up. It's a little bit of myofascial stretching. So kind of stretching the rectus abdominis. A little bit of stretching of the obliques. And then push this way. How's that feeling? Good. Alright. So we're going to do a little Swedish in there. I'm going to go clockwise. So we're going to come up the ascending colon, transverse colon, and then descending colon. How's that feel?
Good.
A little uncomfortable?
No. People need to have their bellies rubbed more often.
Dogs like it. That's great. Alright, so now I'm going to slowly go into the iliacus. So the iliacus sits inside the iliac fossa of the pelvic bone or the coxal bone. We want to find the ASIS, which is right about here. Is that okay? A little tender? Too much? What you want to do is you want to find that ASIS and you want to hook your thumb on the inside very gently and very slowly. And if you want to make this a little bit more bearable for your client, I'm going to have you lift your knee and put your foot on the table. No? Maybe not that high. Is that okay? All right, so this way we're shortening the muscle slightly. Okay, just compressing right in here. And we're sinking into the muscle very slowly. Let me know when that starts to ease up. Okay, starting to ease up a little bit. All right, from here, I will have you slowly lower your left leg. And then bring it back on up. I can have you do that 2 more times if it's comfortable. All right. And then just slowly lower it back on down. And when you're coming out of the iliacus, you want to pull out very slowly. All right. Doing okay?
Mm-hmm.
All right. Feel like we can go in for the psoas?
We can try.
We can try. All right, so the psoas, what we want to do is we want to find the belly button, the ASIS, and we're going to come somewhere in between the middle of those two, which is right about here. And when we're going down, you want to circle down because we're actually pushing past the guts and some other muscles, a bunch of fun little things.
Ow.
And you run into that. Questions you might want to ask your clients is if they're constipated, if they're on their period, if they have polycystic ovaries. Those are things you're not going to want to dig into the psoas. Okay. And once again, if you want to make this a little less uncomfortable, have your client lift their knee so it shortens the muscle a little bit. Okay, how's that feeling? Better. Okay. I'm not going to make her move her leg. I'm going to be nice. Doing okay? All right. And once again, when you're coming out of this area, you come out very, very slowly. All right. And you can just relax your legs. And then just finish up with a nice little. Is that feeling okay? Okay. And then to redrape, you just pop that back on up and cover it on up. And if you want to end with using like hot rock right on the belly or a hot pack right on the belly, that'll feel really nice. All right, feeling good?
Mhm.
All right.